Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Alzheimer's disease. Alzheimer's disease is actually the most common cause of dementia in elderly is Alzheimer's disease and the risk factors of Alzheimer's disease. In the risk factors of Alzheimer's disease, In the risk factors of Alzheimer's disease is a dementia. It causes dementia, that is forgetfulness. It is most commonly seen in old age. In patients with low education, have increased chances of Alzheimer's disease. Positive family history has shown to have a better an increased risk of Alzheimer's disease if the patient's family patient's family, if anyone from the patient's family has Alzheimer's disease, then the patient is more prone to have Alzheimer's disease. Then female sex is more it is more commonly seen in females when compared to males. If the patient has past history of head trauma, then he is more prone to have Alzheimer's disease, especially head trauma with concussion is mostly associated with Alzheimer's disease. If the patient takes aluminium or mercury toxicity, aluminium and mercury toxicity is also associated with Alzheimer's disease. Then sometimes viruses or exposure to prions can be associated with Alzheimer's disease. And then genetic factors include mainly the Downs syndrome. Actually, there is a gene called as APP gene or is present on chromosome 21. If there is any mutation in this APP gene, this will result in uh, Alzheimer's disease. Similarly, there is presenilin gene. Presenilin 1 gene is present on chromosome 14, and we also have uh, presenilin 2 gene is also present on chromosome 1. On chromosome 1, we have presenilin 2 gene, whereas on chromosome 14, presenilin 1 gene is present on chromosome 14. Then we also have ApoE4 gene, which is present on chromosome 19. So all these are associated with Alzheimer's disease. Then we have ApoE2 gene. This ApoE2 gene, which is present on chromosome 14, it is actually protective for protective for Alzheimer's disease. It is protective for Alzheimer's disease. Then increase in blood homocysteine level due to any reason. If the homocysteine level in the blood is increased, this is also a risk factor. It is also a risk factor for Alzheimer's disease. Then if we see smoking is not a cause of Alzheimer's disease, but smoking is not a cause of Alzheimer's disease. But if we see the use of NSAIDs, if the patient uses NSAIDs, it is found to be associated with decreased risk of Alzheimer's disease. Use of NSAIDs is associated with decreased risk of Alzheimer's disease.
thank you and thank you for watching.